Hello, everyone, and welcome back to another thought-provoking episode of Healing Horizons. Today, we're tackling a subject that's both harrowing and hopeful: fentanyl addiction and the role of Ibogaine therapy in addressing this modern epidemic. I am pleased to welcome Will, an esteemed expert in Ibogaine therapy, who will be sharing his insights on how this treatment can serve as a beacon of hope for those struggling with addiction. Welcome to the show.
Thank you, Chris. It's a pleasure to be here, and it's vital that we have these conversations. Addressing addiction and discussing viable solutions is more pressing than ever. I'm looking forward to delving into the potential of Ibogaine therapy in supporting individuals on their path to recovery.
Let's get started by discussing the current fentanyl crisis and its widespread impact. Can you shed some light on how pervasive this issue is and the toll it's taking on individuals and communities?
Fentanyl is now considered one of the leading causes of drug-related deaths globally. It's incredibly potent, being 50 to 100 times stronger than morphine, and unfortunately, it has become a common additive to illicit drugs. Its prevalence has caused a significant increase in overdose deaths, affecting countless families and communities. The crisis isn't just about the immediate impact of these substances, it's also about the long-term socioeconomic effects on communities, often leading to strained healthcare systems and prolonged mental health challenges for individuals and their families.
It's alarming to hear how severe the situation is. Given this challenging backdrop, let's move on to how Ibogaine therapy fits into the picture. Can you give us an introduction to Ibogaine, touching on its origins, historical context, and cultural significance?
Certainly. Ibogaine is a naturally occurring psychoactive substance derived from the root bark of the Tabernanthe iboga plant, which is native to Central Africa. Traditionally, it's been used in spiritual ceremonies by the Bwiti people in what is now Gabon. For them, it serves as an initiatory rite, a tool for spiritual discovery and healing. In the context of addiction treatment, its potential was discovered when it was found that Ibogaine could significantly reduce or even eliminate withdrawal symptoms for individuals struggling with opioid dependence. This discovery led to increased interest by scientists and clinicians wanting to understand how this powerful compound could assist people in overcoming addiction.
That's truly fascinating. It's intriguing how a traditional substance can transition into a modern therapeutic application. Let's explore the science behind Ibogaine. How does it work in the brain, and what makes it effective against addiction?
Ibogaine's effects on the brain are complex. It interacts with several neurotransmitter systems, primarily targeting the NMDA receptors and opioid receptors, which are deeply involved in addiction. Its action at these sites helps to reset neural pathways disrupted by substance dependence. This resetting can reduce not only withdrawal symptoms, but also cravings, thereby offering individuals a unique opportunity to engage in treatment without the immediate physical barriers of withdrawal or intense craving cycles. Furthermore, the psychoactive properties of Ibogaine often lead to introspective experiences, which can help individuals confront underlying emotional and psychological issues contributing to their addiction.
What you're describing is both biological and deeply psychological, which certainly sets Ibogaine apart from traditional treatments. Could you elaborate on how Ibogaine therapy compares to more conventional methods for treating opioid addiction?
Traditional treatments often rely on a combination of medication-assisted therapy, MAT, and behavioral counseling. Medications like methadone or buprenorphine are commonly used to manage withdrawal and cravings. However, these treatments typically require a longer commitment and ongoing use of another opioid. Ibogaine, by contrast, offers the possibility of significant change through a single treatment session, although it's not a standalone cure and requires comprehensive aftercare. The main difference lies in Ibogaine's holistic approach, addressing the physical components of addiction while catalyzing psychological healing and introspection, which can empower individuals to pursue more meaningful recovery paths.
That holistic aspect is indeed compelling. Personal stories often illuminate the nuances of such treatments vividly. Could you share some testimonies from individuals who have successfully overcome fentanyl addiction using Ibogaine?
Of course, there are numerous moving stories I can recount. One individual I worked with was a young man who had been addicted to fentanyl for several years. Before Ibogaine treatment, he experienced intense cravings and several unsuccessful rehab attempts. After his Ibogaine therapy session, he reported not only feeling free from cravings, but also experiencing profound personal insights that motivated him to rebuild relationships and pursue new life goals. Another case involved a woman who described her session as life-altering. She emerged with a clear understanding of the emotional pain she had been medicating with substances and began her journey towards healing that emotional trauma. These stories highlight the potential for profound transformation when Ibogaine is used responsibly within a structured and supportive therapeutic setting.
These testimonies capture a shift that many seek but rarely find in traditional treatment programs. However, it's important to discuss potential downsides. Could you elaborate on the risks associated with Ibogaine treatment?
Absolutely. Acknowledging risks is crucial for anyone considering this therapy. Ibogaine can have intense physical effects, including ataxia and cardiovascular stress. This is why medical screening and oversight by trained professionals during the treatment are imperative to minimize risks. Accessibility in an unregulated environment or by inadequately trained practitioners can result in complications. Moreover, the psychological effects can be overwhelming for some, particularly those with a history of certain mental health disorders. While promising, Ibogaine is not suitable for everyone, and it requires a careful, individualized approach to treatment.
It's clear that Ibogaine therapy requires a considerable commitment to responsible use and providing the right environment akin to a comprehensive preparation and aftercare plan. Can you elaborate on how a supportive community and structured aftercare contribute to successful outcomes with Ibogaine treatment?
Supportive community and structured aftercare are key components of sustainable recovery, not just for those who have undergone Ibogaine therapy, but for anyone grappling with addiction. Aftercare involves providing individuals with continued psychological support, therapy, and sometimes incorporation into support groups. This helps integrate the insights gained from Ibogaine treatment into daily life. Building a community that fosters understanding, accountability, and encouragement can significantly reduce the risk of relapse. The post-treatment phase is when individuals need ongoing support to cultivate sobriety as well as personal growth.
With all these factors at play, it's understandable why the legal and ethical considerations surrounding Ibogaine therapy are a matter of discussion, especially in places like Mexico. Can you provide some insight into these concerns?
Certainly. In Mexico, Ibogaine is not classified as a controlled substance, allowing clinics to operate legally under specific medical and ethical guidelines. However, this legal gray area also necessitates careful attention to the standards and credibility of treatment centers. Ethical considerations include ensuring informed consent, transparent communication about the potential risks and benefits, and prioritizing patient safety. Mexico has become a hub for Ibogaine therapy, largely due to these regulatory conditions. It's important for potential patients to carefully research and select clinics that adhere to rigorous safety protocols and ethical practices.
For those listening who are interested in exploring this form of therapy, how can they access resources or information about pursuing Ibogaine treatment?
There are several paths to accessing resources and information on Ibogaine therapy. First, it's crucial to conduct thorough research on accredited Ibogaine treatment centers and read reviews from previous clients. Seeking guidance from addiction specialists who understand the context of Ibogaine therapy can also provide individualized advice. Additionally, global networks and communities online can offer personal insights and support. For those ready to explore treatment, contacting reputable clinics directly for consultations can facilitate informed decision-making and preparation.
This has been such an eye-opening discussion. Your expertise and insights have certainly provided hope and information for those in need of alternative treatments. Before we wrap up, do you have any parting thoughts or encouragement for listeners who may be struggling themselves?
For anyone listening who is struggling with addiction, trauma, or mental health, know that you are not alone, and there are diverse pathways to healing available. Traditional methods can be effective, but exploring alternatives like Ibogaine therapy might provide additional avenues for recovery. It's important to find what resonates with you, prioritize safety, and seek out supportive communities and professionals who can guide you. Healing is possible, and every step you take towards recovery is significant.
Thank you for those encouraging words and the comprehensive guidance you've provided today. That wraps up this episode of Healing Horizons. We hope our discussion on Ibogaine therapy has shed light on the potential recovery paths available and inspired hope for those facing the daunting challenge of addiction. Remember, whether it's through science, spirituality, or shared journeys, healing is within reach. Thank you for tuning in, and we hope you join us next time as we continue to explore the expansive landscape of healing therapies.